Hi, we're here with Dr. Tamyra Comeaux. Dr. Comeaux is board certified in OBGYN. She is board certified in anti-aging and regenerative medicine, board certified in integrative cancer care. She is an herbalist and essential oilist and specializes in a lot of things. And she's a big part of our wellness program here at Radiance. So the reason we incorporate wellness into our medical aesthetics program is that much of what we do in aesthetic medicine is a controlled injury. We injure the skin and it responds by healing from the inside out. And if someone is not in optimal health, they are not going to have as robust of a response as someone who is. So Dr. Comeaux, tell us, when patients see you for just overall anti-aging, what types of things do you do?
So, I market myself as a hormone specialist. However, I always tell people, I can give you all the hormones in the world, but it won't fix a deficiency in vitamin C. So sometimes I find out, what do you eat? Are you deficient in something because your diet lacks a particular thing? Some people might hate fruit. Then I'm like, okay, what about your vitamin C? People say, I hate dairy. What about your calcium? So I ask people a lot of questions because we really tailor their treatment to what's going on with them and not just the same thing as the person who came in before them. They might need very different things. So a lot of times people will tell me things about their diet and I'll say, well, you don't act well with dairy. So why is it in your diet? Maybe that is actually something that's interfering with what's going on with you. And then we get to the hormones because we kind of have to lay a foundation of health before we just throw hormones at the situation, even though we know they're an important part of what's going on. So it's really a comprehensive approach to your health.
Right. And also as part of our weight loss program, I know that as we all get older, we find that it's just more difficult to lose weight. So how do you approach that? How do you help people lose weight?
Right. So one of the things I explain, so when people come to see me, they say, oh, I'm eating well and I barely eat anything and I'm running marathons every day and I can't lose weight. And I say, well, when you were 20, did you have to do all that? And they say, well, no, I didn't. Of course, I ate what I wanted and sat around and didn't really gain weight. And I'm like, my job is to make you 20 again. I don't put you on a new diet and make you starve yourself. I make it so that you don't have to starve yourself. So, it's interesting. I had a patient once who came to see me and I, of course, explained my process. And I said, if it took you 20 years to gain this weight, you won't lose it in 2 weeks or 3 weeks or a month. So we worked together actually for a year. And I said, what's your goal weight? And she goes, well, when I was 30, this was the weight I was. I was 40 pounds lighter and I'd like to be that weight again. So a year later, she's at that weight. She'd lost 40 pounds and, with hormones, and I changed her diet. I mean, I didn't put her on a diet, but we found the right eating regimen for her. And I said, okay, so now you're at your goal weight. And I was like, so you're like you were 30. She goes, no, I'm better than 30. When I was 30, I was starving myself. I was exercising excessively to maintain that weight. Now I kind of eat what I want. I go on vacation. My weight doesn't bounce back up and down because I'd restored her metabolism. Restoring weight loss is different than restoring metabolism. And I don't market myself as someone who promotes weight loss. I just say if we get everything corrected, your body will naturally behave like it's a younger version of you. And that's what we want to get back. We want you to actually, have that, take that away with you.
So if you'd like to see Dr. Comeaux, give us a call here at Radiance.